Helping the homeless who have HIV afford a home can also help them with the treatment they need to live a normal life.
That's the goal of the Triangle AIDS Network. Fox 4's Lauren Huet reports a grant the Beaumont City Council approved today will help the network provide housing for patients in need.
Dr. Shannon Schrader is the medical director of the Triangle AIDS Network. He says it's extremely important for people with HIV to take their medication.
If you do not take your medicines at least 95% of the time, preferably 100% of the time, you develop something called resistance to the medications, and they stop working.
But it's tough to get the medication if you're homeless.
If they're out on the streets, not knowing where they're going to live, then they're not going to be coming to their doctor appointments, and they're not going to be taking their medications. So when we can get them to a stable housing, then we can get them back into care.
Kathleen Berryman is the housing coordinator for the Triangle AIDS Network. She says the $144,000 grant will allow the network to continue helping 20 patients with their rent and utilities.
Once we have money to put somebody on our housing program, because it's kind of a small grant, we let them know that they can find a place to live, we can pay their deposit, and we can help them get their lights turned on.
About 35 are on the waiting list for a home that makes it more likely they'll get the treatment they need for HIV.
When you're on treatment, the risk of spreading HIV is much lower. So when somebody's out on the streets not taking medications, then they are possibly spreading HIV to other people.
An outcome the AIDS Network wants to avoid, using grant money to guide patients toward testing and treatment that will allow them to live normal lives. In Beaumont, Lauren Huet, Fox 4 News.
And nurse practitioner Kristy Blackwell works with the Triangle Area Network. She's here to give us a closer look at the issue of HIV and its impact in Southeast Texas. And first off, Kristy, some people may have noticed that you were known as the Triangle AIDS Network, and now you're known as the Triangle Area Network. How has your mission expanded?
So what we've done with the Affordable Health Care Act, obviously there's an increased need for practitioners and providers. And we've been in the area for almost 3 decades providing care. We're the people to come in and just expand that to the community. There's going to be a lot of patients that need a physician, and we're already there set up in the community and willing and able to help. We're also expanding to treat hepatitis as well, hepatitis C specifically.
Well, Kristy, how many in Southeast Texas have been diagnosed with HIV, and could that number really be higher than we think?
Oh, absolutely. Like with any other disease, you have patients that haven't been diagnosed yet. That number probably changes on a monthly basis. Through our free screening that we have patients that are newly diagnosed on a weekly or monthly basis, and they come into care at our facility. And then we have patients too that move in from other areas to seek care from TAN.
Okay. How do our numbers rate to other cities our size?
We are levelizing as a whole. Beaumont and Houston, Austin, Dallas, places like that pretty much are levelizing to have the same percentages. And I believe it's not because we have more patients that are becoming infected, but because we have patients that are more familiar with the care that is available and they're actually seeking treatment, which is a good thing.
Now, we heard in Lauren's story that 35 people are on the waiting list for housing. Does HIV treatment affect the lower income people more because the treatment is so expensive, or how does that work out?
You know, I think it's a combination of both factors. Lower income people in general have more health disparities because there's less available to them. Unfortunately, because of the stigma with HIV, some patients whose diagnosis is found out are removed from their housing situation, they're displaced. Some suffer from what we call opportunistic infections, so they lose their jobs, they're not able to go to work because they're ill. So it's a combination of those. And then the treatment for HIV is expensive, and if they don't know that services are available, that can be extremely expensive.
Right. As far as the program, how does it break down as far as how much each patient is eligible for?
It's a needs assessment. We have wonderful case managers that have been experienced in this for years to determine where those funds need to go. Unfortunately, with Ryan White and housing grants, we've suffered a little bit of a cut, both on state and national levels. So we do needs assessments on patients to determine who needs what, and we're able to provide not only help with the medical care and the medications, but transportation, housing, as you mentioned, and anything else that we possibly can to assist them with the disease process.
Well, some may object to have their tax dollars go toward helping out patients with HIV. How do you respond to that?
My medical response is the reason healthcare is so expensive now is because of our behavior as a society. Sedentary lifestyle and high-fat diets are the reason why we have the highest rates of hypertension, diabetes, and other lifestyle issues like that. And as we know, chronic disease management is better managed the earlier that we know about it. So if we make people comfortable getting into care sooner, certainly it's cheaper for everyone, including the taxpayers, to pay for these diseases.
Is a program like this long overdue? Is this something you feel like we should have had a long time ago, or is the need becoming more?
I believe that it's long overdue. Unfortunately, like I've already mentioned, the stigma of HIV makes people a little bit concerned to get into care. There's a concern about issues with people finding out about their diagnosis, which is another reason why we're so happy to expand our care to include HIV, hepatitis C, and primary care. It's a way to be all-encompassing for this area and take care of a variety of people.
All right, Kristy, thanks so much for being with us tonight.
Thank
We
you
really
so much.
appreciate you coming in.
Thank you.
Thank you.
Okay.